High blood pressure or hypertension sounds simple, right? You just take a pill, check your numbers, you're good to go. But what most veterans don't know is that hypertension is like a silent domino. It causes a chain reaction of other conditions that can raise your VA rating if you know how to connect them. So today, that's what we're doing. We're going to jump into and break down the top 5 hidden conditions caused by hypertension. Number 3 is a condition. It's one that, if service connected, it can far exceed the primary condition of hypertension and can be rated at 100%. And stick around to the end because the number 1 condition is one of the most overlooked secondary conditions in the entire VA system. But do me a favor. Help me help you. I realize you can just skip to the end, find out what the 5 conditions are, move on with your day. But the real meat of helping me help you is what is being said, not what is written. So give me 20 minutes or less, and I'll give you enough information to put you closer to or in that 100 club. I'm Mr. X. I'm the guy behind the guy, giving you all the information you want to know and need to know about the VA claims process. And this is the VA Top 5. All right, coming in at number 5, chronic kidney disease. So, when your blood pressure stays high or elevated for a long time, it can damage the small blood vessels in your kidneys, making them work overtime. And over time, this can lead to reduced kidney function, which is directly linked to hypertension, or can be. So, if you have abnormal kidney labs like elevated creatinine levels or reduced GFR. Now, GFR, that's how the VA breaks down and evaluates reduced kidney function. GFR, and I'm going to slaughter it here, so bear with me. GFR stands for glomerular filtration rate. Now you know why it goes by just GFR. So if you have impaired GFR levels, which basically means that you have reduced kidney function or renal function, then based on that number, generally the lower, the worse it is. Not the higher. The lower it is, the worse it is. But based on that, then the evaluation is then assigned based on the eGFR number. Okay. Now, one thing to keep in mind with chronic kidney disease or renal disease, okay, the kidneys have a number of different names and conditions related to reduced kidney function. I've seen it called, and I'm going to miss a few here as well, chronic kidney disease, chronic renal disease, nephropathy. It has any number of names. So, pro tip here, if you have a diagnosed kidney disease or kidney dysfunction, okay, and you are service connected for hypertension, then I would absolutely submit a secondary claim for whatever diagnosed condition you have as secondary to the hypertension, because it could absolutely be related. On top of that, if you have the lab findings that show the GFR number in them, if you have reduced numbers, below 30, below 60, below 80, okay, those can be highly compensable evaluations, 30, 60, 80%, high numbers, okay? So keep that in mind. Number 5, chronic kidney disease. Number 4, cognitive impairment, sometimes called brain fog. Hypertension, what it does is it restricts the blood flow to the brain and other blood vessels all over your body. Over years, that can lead to memory problems, trouble focusing, or even small strokes. Now, many veterans report feeling off or forgetful and don't connect it to their blood pressure because oftentimes with hypertension, depending on how long you've had it and the readings, the severity of that hypertension, depending on your age, as you get older, they just chalk it up as, hey, that's part of getting older. You're becoming forgetful. Okay. Now, that may be true in some cases, but in other cases, it's not. So if you've got documented hypertension and you have a new onset symptoms of memory issues, then you might have a secondary cognitive condition worth claiming. So don't ignore the fog. It's not just getting older. That could be very well your blood pressure talking to you. All right, coming in at number 3, heart disease. This one's almost a freebie. I say almost because the VA, what it does is they often overlook it unless you can make the clear connection. Hypertension is a major cause of numerous heart issues. It can be related to coronary artery disease, can be related to arteriosclerotic heart disease, it can be related to left ventricular hypertrophy. That's the thickening of your heart muscle. It can even be related to heart failure, heart issues, valve issues, and even AFib or tachycardia. So, if your doctor says that your heart is working harder because of that high blood pressure, then that's the start of a secondary claim right there. Think about heart disease as well. And I'm just going to say heart disease on the surface because there's lots of names for it. Okay? Basically how it's evaluated is it's based, the VA rates heart disease based on your MET score. Now that's your metabolic equivalency testing. So if you go upstairs and you're winded and you can't move, if you can only walk a quarter mile without having chest pain, angina, and other things like that, then that's how the condition is evaluated. Now, one thing I want you to keep in mind, especially if you're already service connected for a heart condition, that MET score, it is highly, highly subjective. It's not a medical test to where the doctor puts in your numbers and how you're doing, and then that gives you a MET score of 6 or 5. Now, the lower the MET score, the higher your VA evaluation is. But based on your lifestyle, your quality of life, and what goes on in your life, that is what the examiner is using to determine that MET score. And if you said the same exact thing, word for word, to 5 different examiners, all 5 of them could give you a slightly different score. Generally 1 to 3 is, in the VA schedule, is rated a certain way. 4 to 6 is a different way, and above that is another evaluation. So, based on the examiner, it could very well determine what that MET score is. So, another pro tip here, if you're service connected for a heart condition, it's less than 60%, then I would consider filing a claim for increase because based on that MET score, based on the subjective evaluation of your prior examiner, you could be very well entitled to a higher evaluation. All right, number 2, vision problems. High blood pressure can cause damage to the tiny blood vessels behind your eyes, leading to a condition called hypertensive retinopathy. That causes blurry vision, floaters, or even partial vision loss. So if you've ever heard an eye doctor say that you've got changes in your retina due to hypertension, that's evidence right there of a secondary condition that you should absolutely claim. Now, going back to the brain fog or cognitive impairment, an examiner or doctor may just want to say that, hey, your vision problems are due to aging. Well, that may not be the case. Similar to cognitive impairment, vision problems could absolutely be due to your hypertension. So like I said before, if you've ever heard that doctor say, hey, you've got changes in your retina due to hypertension, right there, the noise, the ding, 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 ding should be going off in your head as if, hey, that's a claim right there. So file a claim for your vision problems. And finally, here we are, number 1, erectile dysfunction. Yeah, I said it. Don't laugh. It's actually one of the most common secondary conditions tied to hypertension and its medications. Here's why. High blood pressure, as I've mentioned many times, it damages the blood vessel walls, making it harder for blood to flow properly. On top of that, a lot of blood pressure medications like beta blockers can cause the erectile dysfunction as a side effect. The VA recognizes erectile dysfunction as a valid secondary condition, and while the rating is 0, you can still qualify for the, with that 0, you also qualify for the special monthly compensation, or SMCK, for that, which basically is just a payment. It's extra money every month to you for the erectile dysfunction. Okay? So whether you're taking medication or not, it doesn't matter. You're taking the medication because of the erectile dysfunction, which may be tied to the medication you take for the hypertension due to the long-term effects of the blood pressure issues. Okay? So this one, it literally pays to claim it, erectile dysfunction. All right, if you stuck with me thus far, here's a few bonus ones for you, bonus conditions. Sleep apnea. Sleep apnea can also be connected to hypertension. So if your blood pressure is being aggravated by the poor oxygen flow at night, that's a potential secondary condition right there both ways. Sometimes the VA sees it as hypertension secondary to sleep apnea. Sometimes it's the other way around. Now, either direction works if the medical link is clear. So keep in mind that sleep apnea is one of those interesting conditions that many veterans claim as due to tinnitus, PTSD, allergic rhinitis. Could be due to a great number of conditions. And oftentimes I've seen those opinions come back and say they're positive due to this and negative due to that. And then months and months later, the same conditions will be applied for and it'll be negative and then positive. What I'm saying is the medical opinions given for sleep apnea across the board are inconsistent. And I'm not saying that's good or bad or right or wrong, okay? Because each one of your files are inherently different based on the evidence at that time, based on what the examiner says. I could see where, it could be positive or negative. So I mention all this just to say, look, if you were denied for sleep apnea and there is a route to claim it again, either secondary to hypertension or another condition, then it's absolutely worth putting in a claim for, because a new examiner with that new evidence may view it completely different than what the previous one did. So don't be discouraged. Other conditions related to hypertension, stroke. Now, sometimes that stroke is sometimes called a cerebral vascular accident or a transient ischemic stroke, okay? Has a bunch of different names. With a stroke, if you have a stroke, the effects and disabilities thereof can be even more numerous, affecting your neurological system, okay? And the third one, peripheral artery disease, can be due to that hypertension. That long-term effect of making it difficult to, pump that blood all over your body can have far number of disabilities that are associated with it. Okay. So if you have any of the above, you might want to consider a claim for any one of these three as secondary to hypertension. So wrapping it up, there you have it, the top 5 conditions caused by hypertension. So if you've got the high blood pressure, don't stop there. Look at your body as a system, because the VA sure won't unless you make the connections for them. What I would do is talk to your doctor if you have hypertension or blood pressure and ask him directly if your hypertension is the cause of any of the other conditions or disabilities that you have. Okay. Now, that's kind of quasi asking the doctor for a nexus statement without coming out and saying, will you write a statement that indicates that hypertension is causing this other condition? Just ask him, hey, so my hypertension, in your next exam, is what I would do. When you're talking about hypertension, say, look, based on this hypertension, I've been seeing some videos, doing some research. Do any of my other medical conditions, are they related to this hypertension? So if you've had a chronic kidney disease or renal disease or reduced impairment, heart disease, vision problems, memory issues, erectile dysfunction, any of the ones mentioned, any of the other conditions, just have them say, look, are these conditions related? And if they are, just ask them to notate that in your file. Okay. And then when you submit a claim for it, then reference what that doctor said, because that's going to go a long way in helping you prove that one of these 5 conditions, if not others, are related to your service-connected hypertension. All right. So do me a favor. If If you watch this video, feel like I gave you enough information to where you can confidently file your next claim for a condition related to hypertension, then you owe me a thumbs up. Okay, drop me a comment. Tell me which one of these conditions you've experienced or claimed. Also, please subscribe for more no-fluff VA claim tips broken down with a little humor and some honesty. I'm Mr. X. Thanks for being with me today. That's VA Top 5.